Good evening and thanks for joining us. We begin tonight with drastic measures being taken to try to contain the outbreak of a mysterious pneumonia-like virus. Chinese authorities are effectively putting a quarantine on an entire city, cutting off Wuhan, where the potentially deadly coronavirus first emerged in December. Planes, trains, buses, subways, and ferries to and from that city of 11 million will be suspended tomorrow. The aim is to cut off transmission of the virus, but it is spreading. At least 17 people have died. More than 500 others are infected. There are now confirmed cases in South Korea, Taiwan, Thailand, Japan, and the U.S. There are no confirmed cases here in Canada, though tonight 5 people in Quebec who recently returned from China are being monitored. The World Health Organization has teams on the ground in China and is holding off on declaring a global health emergency for now. It's advising governments to be vigilant and ready to test anyone who has traveled to the affected region and has symptoms like cough and fever. Crystal Goomansingh has our top story tonight.
They have no option but to get up close and care for those who are ill. The new strain of the coronavirus is spreading fast in China and beyond. Chinese officials in Wuhan have made masks mandatory and are implementing drastic measures to limit people's movements.
Taking the action that they think is appropriate is very important. We stress to them that by having a strong action, not only they will control the outbreak in their country, but they will also minimize the chances of this outbreak spreading internationally.
In Wuhan, where the virus first appeared in December, hospitals are overrun with people with flu-like symptoms. But in some cases, it can be much more serious. This new virus is in the same family as the common cold. It's triggering fear because it's also the same chain as SARS. Europe's busiest airport, Heathrow, will be screening for signs of illness on planes and asking more questions of people when they land.
We're also asking them to self-declare, in other words, if they have any signs or symptoms, to let us know so that that can be assessed and any appropriate further assessment.
In just a few days, the virus has led to hundreds of confirmed cases and more than a dozen deaths. Containing the virus is critical. Wuhan is a large center and a commercial hub. UK officials anticipate the infection rate will reach into the thousands.
It is vital, clearly, that we understand the rate of human-to-human transmission. That will determine, frankly, how the feasibility of control, and if control is feasible, what measures will be needed.
There is no vaccine. The virus is new, so no one knows exactly what it can do, and there's always potential for it to mutate. Officials with the World Health Organization will meet again Thursday as it continues to monitor the virus. Crystal Goomansingh, Global News, London.
Trying to contain an outbreak of an infectious virus while not completely shutting down trade and travel is a balancing act. Canada's experience during the SARS outbreak in 2003, when 44 Canadians died, taught authorities many lessons. Tonight, Eric Sorensen takes a closer look at the new coronavirus and how ready Canada is for it.
In Shanghai, they quickly sold out of face masks. As viruses go, it's still not clear how transmissible and how severe the novel coronavirus is.
How efficient is human-to-human transmission? Because really that's going to be one of the driving forces behind whether or not this turns into something a little bit larger or whether or not we're able to get this under control a little bit quicker.
There are many coronaviruses, from the new novel coronavirus to severe cases like SARS to the common cold. Coronaviruses are commonplace among animals. It's when they spread animals to humans, then from human to human, the risks increase.
The novel coronavirus was first found in Wuhan, China, and has spread to nearby countries and to the United States. There's so much travel from China to the rest of the world, a further spread is entirely realistic. Compare with SARS. It also began in China. In 2003, there were more than 8,000 cases. 90% were in China, Hong Kong, and Taiwan. But SARS spread to more than 30 countries. And outside Southeast Asia, Canada was as hard hit as any other country, an estimated 250 cases and 44 deaths.
It's been 18 years since SARS, and this is looking there's many similarities to SARS in terms of a big outbreak in China with lots of people hospitalised and some indications of international spread. Is it of international concern? Definitely.
Toronto in particular was hard hit by SARS and the global reaction to it. The World Health Organization told travellers to avoid coming here. Pamphlets were distributed at the airport. Healthcare workers were forced to wear more protection. Hospitals restricted visitors. Thousands of people were quarantined. Hand sanitizing became a widespread practice in 2003. Canada seems much better prepared now.
Certainly there's education and screening at ports of entry for this. We now have tests and instructions to healthcare providers on how to manage cases. As bad as SARS was, the hospitals here are certainly well prepared now from after that experience to deal with imported infectious diseases.
The global response to the new coronavirus has been much quicker than it was for SARS, thanks in part to China's transparency in reporting it early. Still, the number of international cases is bound to rise, and just one case in Canada could create a national sense of urgency given this country's experience with SARS. Eric Sorensen, Global News, Toronto.